This is a software demonstration for the Spine 3D LiDAR machine by Sensor Medica. This particular patient is a 62-year-old male with chronic lower back pain who has tried everything from chiropractor, physio, osteopath to neurosurgical opinions. And he come to our practice feeling like he was in Last Chance Saloon. And this is what we picked up with the Spine 3D LiDAR. Probably the best view to visualize this patient's issues would be the deep color and the concavity images. On the deep color, you can actually see how the tip of his left scapula protrudes right down to the lumbar spine and how the pelvis is actually rotated backwards on the right. So we're actually seeing increased contours on both the deep color and the concavity images. And they show that pelvic obliquity and also how the lumbar left thoracolumbar paraspinal muscles are more pronounced or much more active. This is just from one view. One of the things we can do on this image is actually select what we want to see. As default, they're all off because it can be quite overwhelming for the patient to see too much data, such as this. Sometimes it's too much information, so we tend to only put on the angle or the point that we actually want to see. They don't tend to care about reference points such as the shoulders, but the angles are quite good for patients to see what the machine is picking up. You can add notes as appropriate. This will be saved within this particular image. And we can transition to the 2D models because it's actually better for the patient to see what you're seeing with less data. And so you have the name on the left-hand side of each of these with the value. And this is the value that the machine has recorded. This is all automatically captured. There's no manual input at all from you as the practitioner. This is showing the degree of rotation. It's showing that the spinous process is moving to the right. So that's actually left lumbar rotation, which would actually match common adult de novo degenerative curvature. It's picking up cob angles, which are quite mild until we reach this point. It's about 32 degrees. And this was corroborated on X-ray. When we look at the transverse plane, we can assess the patient in rotation, adding or removing normative values and set points to show a certain point. So, for example, we can add the shoulders and the pelvis to see the relationship of their alignment and what the spine does in between. And more often than not, that if the shoulders and pelvis are not aligned, the spine will corkscrew from one to the other, and those points of excessive torque, particularly around the transitional segments of the CT junction, the thoracolumbar junction, and the lumbosacral junction, then obviously you can get a lot of issues that this torque process can cause, and therefore your management can have significant impacts on that patient's care and quality of life. You can also look at the foot pressure data. If the platform was attached, you can see the center of posture is slightly more weight bearing to the left hand side, and this actually shows you the number of kilograms left to right, which can be significant. And then we can look at the data from front to back, so we can actually see that they are predominantly left weight bearing, but the difference on the right foot from forefoot to rear foot is considerable. You can see where the cursor is now, you can hardly see any pressure on the toes other than some moderate left big toe pressure. These points here are the maximum points of pressure. So the maximum point in each foot is in the heel, and the total maximum is over the left heel. You can see the red on that left heel is showing an excessive amount. When we look at the sagittal view, we can actually see overall this patient probably has quite flattened curves, particularly lumbar curves. So if we're clicking the normative values, you can see there's quite a lot of orange data showing that there's data within those sections outside of the normative range. And so he has a slightly increased upper thoracic curve, but a flattened lower thoracic kyphosis, and then very, very flat lumbar lordosis. And as you'll already know, there's a huge incidence between chronic adult back pain and the loss of lordosis. And so without needing an x-ray, we can predict the amount of curve they have from a scoliotic sense or a lordotic kyphotic sense, and develop a management plan that can work in 3 dimensions. The reports are very easy to generate. They're auto-generated with the same text, but you can add anything you wish to in here. You can also perhaps have saved paragraphs that you write for most patients, particularly a tagline if you wish to have a paragraph at the end that can just be copied and pasted.